Chapter 21 is on somatic symptom illnesses, and the first term we need to talk about is the psychosomatic. This term is going to be important to understand to be able to grasp the whole chapter. And this basically just says that the mind can cause the body to create physical symptoms, or it can worsen the physical illness that the person is currently experiencing. So we probably all heard that if you think you're sick, then you're going to get sick, and vice versa. So if you're thinking that you're not going to get sick, then you won't get sick. Well, this saying basically comes from this term here. So these real symptoms that a person has, they can begin, continue, or worsen as a result of emotional factors as well. So an example of this is the medical condition of diabetes. We have learned when a person who has diabetes in the hospital and their body is undergoing a whole bunch of increased stressors, what do we need to do more often? Well, we need to check their blood sugar because they are at risk for it being out of range. As with emotional stress as well. So in diabetes, it's not only physical stress, but then emotional stress. They're at risk for having their blood sugars out of range. Therefore, the mind and the body, they have a connection in the person's state of health. So that's why psychosomatic, which basically says there is a connection between the mind and the body. That's important to understand within this chapter. Somatization, it can be broken down to be understood as basically when a person has anxiety or depression, or any type of unexpressed emotions, it can cause true physical symptoms to occur. Somatic symptom illness. This was formerly known as somatoform disorder, in case you've ever heard or seen that terminology. And it's basically a mental disorder that is characterized by physical symptoms that suggest a physical illness or injury. People with somatic illness, symptom illness, they are not faking their symptoms, so their symptoms are very real. So the pain that they're describing, or the other problems that they're describing, they're real, but there's no organic basis for their complaints. So after they've gone through all the testing, labs, diagnostic, radiology, everything that they have, everything comes back negative. And even after they receive the negative test results, patients, they're still going to believe that they have something wrong with them, which suggests a diagnosis of somatic symptom illness. Whenever they're given this diagnosis, it can create a lot of stress and frustration for the patient as well, as they're going to feel unsatisfied and that there's no explanation for their symptoms. And stress often leads patients to become more worried about their health, which, as you can see, is just a vicious cycle that can persist for many years. So there are many types of somatic symptom illnesses. The first one is somatic symptom disorder. This is when a person experiences one or more physical symptoms that has no organic basis. Okay, so that means that they went to the doctor, they've got everything ruled out, and they can't find a reason for that. So one or more symptoms for that. Conversion disorder, when there is a sudden, unexplained deficit in sensory or motor function, such as going blind, being paralyzed, not being able to talk, etc. These episodes of conversion disorder are nearly always triggered by a stressful event or an emotional conflict. And there's a good story in your book on page 410 that gives an example of this, so make sure you read that to correlate the conversion disorder. The exact cause of conversion disorder is unknown, but it's believed to be the way the brain's way of reacting immediately to something that seems like a threat. So just an increased stress, emotion in the body takes that as the threat and basically just kind of shuts down. Pain disorder is where the primary physical symptoms is pain, which is generally unrelieved with medications. And then the fourth one is going to be the hypochondriasis, and this is they're preoccupied with the fear that they have a serious disease or they're going to have a serious disease, and this is, we know this as a hypochondriac. So we often see patients with somatic symptom illness, they're going to go to multiple doctors. And why? Well, because they still believe something is wrong with them after all the tests show that there's no organic basis, and they're basically going to Dr. Hop until they can find one that will diagnose them. Now, these two disorders that are related to somatic symptom illness are interesting. Malingering is when a person intentionally exaggerates their symptoms so they can get something. So either they're wanting pain medications, they may be wanting time off work, they may be wanting to file for disability, but they don't really qualify for disability, and those type of things. Factitious disorder is when a person intentionally hurts themselves or others to gain attention. Munchausen syndrome, I'm sure you guys have all heard about that. This is when a person intentionally hurts themselves by injury or illness, but they do not intend to commit any type of suicide or anything like that. They just want some attention. Munchausen syndrome by proxy, this is whenever they cause illness or injury to someone else to gain attention, or so they can look like the hero in that. Make sure you understand what internalization and the primary and secondary gains and how they relate to the somatic symptom illnesses. So oftentimes patients are going to have depression whenever they have been diagnosed with the somatic symptom illness. And SSRIs, they're the first line of treatment for depression, so they're going to be the first line of treatment here as well. If the patient has a pain disorder, we're going to want to teach them how to control their pain with imagery, relaxation, and we're going to want to teach them to use their NSAIDs instead of being prescribed the narcotics. Also, patients who attend therapy have been shown to show improvement as well. So with your assessment, it's important to always assess the patient, what they're complaining of, even though they may be diagnosed with the somatic symptom illness. But whenever time they come in, we still need to assess what their complaints are, because can they still, can they still be diagnosed with strep? Yes. Could they one day possibly have cancer? Yes. So they're still at risk for developing, these organic conditions that are identifiable. So just because they have this diagnosis does not mean that we don't look into anything else. We always still need to be assessing them to make sure. Read over this assessment section and understand that. And also some nursing interventions that we can do is just some health education and teaching, such as teaching how to eat the correct food, what foods to avoid, how much sleep to get, and those type of things. Just teaching a person, health education that can help a person feel better as well. And we also want to teach them how to express their feelings and emotions correctly instead of using that internalization.